In this video, we will discuss how to use the ICE model to explore the patient's perspective within a consultation. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. A patient's thoughts, feelings, ideas, concerns, expectations, support systems and previous life experiences influence not only their ability to cope, but also the physical effect of an illness itself. All of these factors are encompassed by something called the patient's perspective. There are two main ways of understanding the patient's perspective. The first is to pick up on cues and respond to these, and the second is to directly ask about their ideas or beliefs, concerns and expectations, which can be known as ICE, ideas, concerns, expectations. We can use this triad to try and gain an understanding of the patient's perspective. Sometimes, over the course of a consultation, a patient's ideas, concerns or expectations may come up organically, especially if you use open questioning techniques, in which you just have to explore the blanks. Alternatively, the patient may not talk about their perspective at all, in which case it is up to you to explore this. In a community setting, one study by Lang et al. In 2002 showed that in response to sequenced questioning about the patient's perspective, 44% of patients revealed specific, significant concerns that had not been otherwise disclosed. This demonstrates the necessity of asking questions if the patient's perspective hasn't already been conveyed. So what does each part of the ICE triad mean? So ideas or beliefs. This is about what the patient believes is the cause or effect of the problem and is what they think is contributing. A patient's ideas and beliefs can be influenced by lots of different sources, such as what friends and family have told them, internet searches or newspapers, and their own background knowledge. It's important to explore someone's ideas and make sure that they are accurate. A patient, for example, that believes a statin is dangerous based on something they've read in the paper may be unnecessarily worrying about that risk as a result. On the flip side, a patient might believe that their joint pain is caused by rheumatoid arthritis because their mother had experienced that same symptom in the same way. So while it is a real possibility they could be linked, it might be that they are unrelated. Your consultation can then point them in the right direction. Secondly, C for concerns. This looks at what a patient is worried about and what they're concerned is going to happen, or what side effects they may be scared of getting. A patient's concerns are often related to their original ideas or beliefs. It's always worth exploring a patient's concerns, as some of them may be unfounded. Other concerns may be wholly justified. A patient who starts on metformin may be concerned about getting stomach upset, as this is something they're quite prone to. But you could talk them through the ways of reducing that risk and preventing it from happening, or taking action if they do experience a stomachache. Exploring concerns and making sure that patients have all the correct information is important to ensure the patient is comfortable with their medicine or treatment, and therefore can aid their ability to follow that through their adherence. Lastly, E, expectations. How does the patient want you to help them? What outcomes are they looking for? What are their goals? It's always a good practice to explore what the patient is looking for from you, as then you will know how you can help them. As well as exploring this, exploring their goals is important. If a patient wants to quit smoking before their granddaughter is born, you can help them towards that goal. And explore their own motivations is much more effective at encouraging behaviour change than dictating some advice on them. In the past, practitioners would often miss the patient's perspective as something that got in the way of the consultation. However, we know now that if you don't explore the patient's ideas, concerns and expectations, you are treating the patient as a disease rather than a person. A person-centred approach has many benefits that we've discussed in depth in this channel before. Exploring the patient's perspective can aid in your diagnostics of their illness, make your consultation more effective and more efficient. You can then relate your information to the patient's perspective, and they're more likely to remember and retain and therefore use that information appropriately. So how do we ask patients about their ideas, concerns and expectations? We really want to use an open to closed funneling questioning approach. Start by asking something open, such as tell me how you've been since we last met. Depending on how open the patient is, they may tell you their ideas, concerns and expectations. Or you may need to move to more specific questions, such as, do you have any ideas as to what's happening or what you think might be causing this? In summary, we've discussed the different components of the ICE model and how you can use this as a guide to explore your patient's perspective within your consultations. Remember, there are a lot of skills and competencies that make up a good, patient-centred consultation, and all of these need to come together. Check out our other videos to refine these other skills.
Thank you for watching Consultations for Health. Don't forget to like our Facebook page, follow us on Twitter and subscribe to this channel.